and some study tips. Students have to have a routine study plan in place to be successful in the nursing program. What does that study plan look like? Well, first of all, you need to determine the best time and place for you to study where you're going to have minimal distractions. Consider maybe investing in some earplugs. Consider listening to recordings during your driving time. But you do need to study a little bit every day. You should also have an alarm or timer when you're studying. It's important for you to study for no more than an hour and then take a break. During that break, you need to do something totally unrelated to schoolwork, such as maybe taking a walk around the house or down the street, walking the dog, playing with the kids, reading a chapter in your book, maybe doing the dishes or one of your household chores, etc. It's also very important for you to engage in some physical exercise routinely. Exercise has been shown in studies to improve content retention. And of course, you need to eat a healthy diet and obtain adequate sleep. Nursing school has the reputation of not being a very restful program, but to be perfectly honest, if you do have a good sleep habit, good sleep pattern, you are going to retain the information much better. And you should also take everything one day at a time and one step at a time. Don't become overwhelmed with the enormity or the intensity of each course. And I will tell you that nursing school is intensive. The key to success is careful planning and simplification of all areas in your life for the duration of your student nursing career. So, create a master calendar with all the due dates and times for every course and refer to it daily. It doesn't do you any good to have this calendar made if you're not looking at it on a daily basis. Coordinate personal responsibilities and activities with your class and study schedules. Work and study only can just lead to burnout. It's also important for you to simplify your life while you're in nursing school and establish priorities and eliminate those non essentials. With work, nursing school is more than a full time job, especially if you're on campus several days during the week. Plan to spend about 3 hours per week studying for every credit hour. That's pretty average. Not everybody is going to study that much. Not everybody is going to have or be able to get everything done within 3 hours per credit hour. So, figure out how much time it will take for you, but understand it will take a while. We do understand that a lot of students have to work during nursing school. If you're on campus, especially, try not to work more than 20 hours a week. Definitely no night shifts prior to clinicals or labs because client safety always comes first. It's important to organize your life. Before you get any further into nursing school, start decluttering and try to make this a habit that you can follow regularly throughout the year. Deal with things as they come up instead of putting them in a pile and, oh, I'll get to it later because later very rarely comes. Start an ongoing to do list. So carry a little pad of paper around or on your phone. Create that to do list. That list, excuse me, If you coordinate it with your calendar, it's going to help keep you from forgetting an assignment, an activity, etc. And I encourage you to not only put your school life on that calendar, but also your personal life activities. It's important to have strong computer skills. You're going to have access to several resources online for information, and you need to be able to navigate the school learning management system or Blackboard. The internet has wonderful sources for information for school assignments. The only thing that we really recommend about looking online for information is you need to verify that information because it's not always accurate. So again, develop and post that calendar, but put it in a place where everyone in the household can see it. Don't forget to add study time on that calendar. And make sure that you're also penciling in time for personal responsibilities and or work. Family time, personal time, laundry, house cleaning, meal prep, etc. A strong schedule can help you accomplish everything that's necessary if you stick with it. It's also important, I mentioned a little while ago, make sure you have an alarm or a timer when you're studying. This helps remind you to stop studying and get up and move around. It also can remind you to spend time with your family, to eat, etc. And again, you will retain information better if you intersperse relaxation time with studying. Your brain is not a muscle per se, but it does function somewhat like muscles do. If you overwork it, it's going to become fatigued and it's not going to hold on to that strength or, in the brain's case, the information that you're putting into it. So you have to take those breaks. Recruit help for household chores if you have kids or if you are married. Don't be ashamed if you can't do it all. Some tasks will wait. Put off what does not have to be done right this minute. And more importantly, learn to say no. Organizing school can also be very helpful. So, where did that paper go? Are those notes for that class? I do recommend that tabs and folders can be very, very beneficial to you. They are your friends. Keep a separate 3-ring binder and or a computer file for each nursing course. And then separate things into categories, such as the syllabus, the course calendar, PowerPoints, study notes, modules, study guide, handouts, etc. Whatever is going to work for your personal organizational methods is what you should use. But be consistent with your filing system and make sure that you're filing notes, papers, etc. as soon as possible so you don't lose them. And having a 3-hole punch can be very beneficial, especially if you keep those paper copies. Make sure that you review that course calendar every day. And don't wait until the last minute to complete assignments. What if something happens? You have problems with your computer, the electricity goes out, there's a family emergency. Oh my goodness, all of a sudden your child is sick and all of your time is devoted to caring for that child. You have last minute responsibilities, etc. You do not know what the future holds. Get things done throughout the week. Don't wait to the last minute. The handbook states that technical difficulties are not acceptable as extenuating circumstances for incomplete work if the work was not attempted prior to the last minute. So an assignment is due at midnight and at 11 p.m., you're starting to work on it right before it's due. Something happens, my internet went out. I've lost my connectivity. Whatever the reason, you may not be able to get credit if you complete that assignment at that late date. So when you're studying, here's some different study tips that are going to assist you in learning and comprehending course material. So within the textbooks, make sure that you're looking at all of the bolded words, the tables, and the pictures. I know it kind of sounds like kindergarten, but it's really important because sometimes those areas are going to hold some very important information. There is a great deal of information in the textbooks, but your instructors are going to help you focus on what is most important. So I recommend that as you're going through your textbook or your notes, that you highlight really important information. Take notes while reading or listening to any recorded instructor recordings or reviewing information. If there's a concept or material that you don't understand, ask your instructor. That's what we're there for, is to help you understand this information. It's also important to use your resources to clarify those muddy areas, and that will include your textbooks, your Kaplan resources, your NCLEX review books, and most importantly, your instructors. There's also AI. AI can assist with understanding a topic, and it can also assist with language issues. It's all about the prompt. So let's say that you have a language barrier. English is not your primary language, and you just cannot figure out exactly what this concept means. Go to AI and ask AI to explain it in oh, maybe an eighth grade level, just to make sure that you're getting it. If you don't get it, then try another prompt. The important thing about using AI pulls everything that's on the internet, and we know that everything on the internet is not true. So it's vitally important that you double check the facts for accuracy. So with AI, it's really all about the prompt. So here's an example of a good prompt to help get the information you're looking for. And I recommend, if you're not getting what you're looking for, try rewording your prompt or giving it more parameters to follow. So listen to this. Explain the difference between peripheral arterial disease and peripheral venous disease using 10th grade language, and base it on the 11th edition of Iggy's Medical Surgical Textbook. So just a thought. Understand that you're not going to learn everything about a topic in the nursing program, but you will learn enough to have an understanding. Some of your future courses and clinical experiences are going to build on that knowledge. It's also important in understanding a topic to learn the pathophysiology behind it. If you know the why and how behind something, it really helps you determine what is normal or abnormal and what do you need to do about this. And another study tip, study with peppermints and then test with peppermints. A lot of your instructors will provide peppermints, and if they don't, most of them will let you bring some of your own. Now, there's several different methods for studying. This is one that has received probably some really important marks on how well it helps students study and retain information. There are a lot of studies out there that support retrieval practice. It is basically an evidence-based neurocognitive strategy that helps improve knowledge acquisition and retention that results in long-lasting learning. It is said that it can be more effective than your traditional study methods. Knowledge transfers beyond exams to the clinical settings. So it's not good for just taking a test. It's also good for actual putting into practice what you've learned. So methods of implementation of retrieval practice include free recall. So this is a way that you can help remember the information. You attempt to recall any previously learned information without any cues within about 2 to 3 minutes. Then once you've done that, you go back and you use your notes to check for accuracy and completeness. The next implementation method is cued recall. This is where you retrieve information from long-term recall using various cues such as numbers, words, letters, or pictures, and then use notes to check for accuracy and completeness. For example, give me 3 symptoms of fluid volume overload. The next method is closed book self-quizzing. This is where you use short answers that cover the course content. It's recommended that you do it 1 to 3 days after studying. You can use course objectives as questions, for example. You can also use case studies. Then you go back with your notes and you check for accuracy and completeness. They say that if you wait, approximately 48 hours or no more than 72 hours to go back and review the information, that it helps with retention. So this is all kind of versus sitting down and cramming for a test where you're just reviewing that information over and over and over again. You're not going to retain it much longer than the exam. The important piece is that you are able to pull this information back out past 1 or 2 days. So if you do it for 1 to 3 days after studying, you'll find that it will be much more effective. The next method is what we call the read test, read test, read test, where you read for about 2 to 5 minutes and then you test yourself over the material. Then you read for another 2 to 5 minutes over different content and then test over the material. And you just keep doing that. And that, again, helps you retain that information. The next method is called spaced repetition. So again, we're using every 2 to 3 days after studying, you attempt to recall any previously learned information without the use of any cues. Then you use notes to check for accuracy and completeness. And finally, quiz with a partner. 2 to 3 days after studying, have a partner quiz you. The partner then uses notes to check for accuracy and completeness. Then you quiz the partner over different material and repeat that process. Again, with the retrieval practice, they recommend studying for shorter periods of time. 30 to 45 minutes are going to be more effective and less painful in learning information. So test tips, test rules, test strategies. Oh, so important to know. Nursing tests are going to be a different type of animal than you have come across in any type of your studying before. And it's really important to know how to approach these questions, how to read these questions, how to dissect these questions so you can achieve the correct answer. With nursing tests, we are not just asking you to memorize information. We want you to be able to apply that information. So, being able to effectively apply test taking strategies on an examination is almost as important as having the basic knowledge required to answer that question correctly. Nursing exams are only going to evaluate the minimal level of competency. These examinations determine if a person has the knowledge, skills, and ability required for safe and effective entry-level nursing practice. Based on textbook practices, not on what you do or have seen in your work or clinical experiences. So, in other words, when you're taking a test, what did you study since the last test? That's the information that you're going to be tested over. What comes out of your textbook, what your instructor has shared with you, not what you have seen when you were at work or at clinical. The people at work, the people at clinical have not necessarily read your textbook. There are some questions that will require critical thinking skills to determine the correct answer. Critical thinking skills require an evaluation and interpretation of client data, an understanding of the client's condition or disease, and the ability to determine the best action that will most effectively meet the client's needs. It's recommended that you complete some practice NCLEX style questions. These questions are going to help you learn the language and help you learn how to dissect the questions. Practice questions that provide rationales are going to help you learn to pick out those key words. And we're going to go over some of those key words here later in this presentation. You can get a lot of practice style questions, NCLEX style questions, just by Googling it. Or AI can provide some. They're not as high a difficulty as some of your other questions. There are also a ton of NCLEX review books available, and some of them can be purchased very cheaply for under $10. Those I do recommend because they also provide the rationale for not only the correct answer, but also for the incorrect answers. And some of your Kaplan exams are going to be very important in helping you learn how to read these questions. With nursing, you not only need the knowledge, you need to know what to do with the knowledge, which is what we call applying it. So discussion questions or case studies can help you learn to put those pieces together. Case studies can paint a picture of a client and walk you through symptoms, treatments, complications, etc. And you also have access to what we call Lippincott client cases for clinical judgment. And we will tell you how to get access to those. Your instructors may assign you some of those client cases, but as a student, you can go in and do as many of them as you want. They will help you put those pieces together. General rules of nursing tests are going to apply to almost every test question. Understand, first and foremost, that there are no trick questions. They're only questions that are going to require you to process information. So you need to know how to process that information. If you've not covered the information, understand it's probably not the correct answer. On nursing exams, always consider the subjects that you're being tested on. Oh, we studied fluid imbalances. So I'm probably not talking about the musculoskeletal system. When a question is talking about assessment, that does not mean we're talking about interventions. So always understand, read the question very carefully. It's going to guide you as to what answer is going to be appropriate. And I've said it before, I'll say it again, that cramming does not work for long-term knowledge retention. We tell you that the information that you learn in class is important, but you can't forget it because we tend to build on that information throughout the entire program. And we do recommend that you study a little bit every day. On questions that are select all that apply, or what we call SATA questions, ask if each response option is true or false. Always assess first with a client change or admission. If the client is all of a sudden complaining of abdominal pain and they weren't complaining of abdominal pain 30 minutes ago, I need to focus on assessing the abdomen. When looking at a client, determine if any of those changes are expected. And does that change require an urgent response? If the change is not expected, always investigate, starting with the assessment. So if you have a change, we always need to reassess. If a response is provided in the question itself, so A, B, C, or D, if it is one of those responses, it is considered to be a viable option. For example, we have a client who has athlete's foot repetitively. We need to provide some teaching. One of the things that we would tell the client is change your shoes every day. Wear a different pair of shoes every day. Don't read into it saying, well, who has enough shoes that they can change them every day? That's not what the question or the response is saying. It's saying if this were possible, you would tell your client to change their shoes every day. Maybe they only have two pair. Well, wear one pair one day, wear the second pair the other day, and alternate. It is what it says it is. Don't discard it just because you don't think everybody could comply with that. Never change answers unless you know that you accidentally clicked the wrong choice. Oh, I meant to click A and I accidentally clicked B. It's important that you trust your gut. You're studying this information. You're hearing about it in class or the presentations, in your assignments. You have learned this information. Don't start questioning yourself. You've spent time reviewing the material, studying the content. Trust your first thought. It will be right at least 2/3 to 3/4 of the time. If you change your answer, you could potentially get a failing grade because you aren't trusting yourself. Carefully read the question and determine what it's asking before you even look at the answers. Disregard information that has nothing to do with what the question is asking. Don't add any words to the question or answer options to make things fit. All information required to answer the question will be located within the question itself. You don't need to add words to make it work. Consider covering answer options with a post-it note or scrap paper until you determine what the question is asking. That can also help eliminate the distraction of the answer choices. Look at each word in the question and answer option. Excuse me. One word might be enough to make an option incorrect. And don't choose the first answer option that just looks correct. Oh, I remember studying that. That must be the right answer, without reading all of the responses. Don't overthink the questions because that will often lead to the incorrect response. Again, you're not trusting yourself. If you start asking, but if, or what if, your response will almost always be incorrect. Determine what answer option will benefit the client the most. And again, address the situation in the question. Nursing tests are nursing competency examinations. The correct answer is going to focus on nursing knowledge and the provision of nursing care. Medical management is not the focus of the test. However, I do want to say that if we have a medication listed as an answer response, we always assume that we have that order. So it's not, well, I can't give that because I have to call the doctor first. No, if that is a response choice, it is a viable one because we assume that we have that order. Again, never indiscriminately change your answers and only change it if you have a specific reason to do so or you accidentally click that wrong response. Maybe you just didn't fully read the question, you missed an important keyword. Well, you can change it. But, oh, I meant to click A and I accidentally clicked B. Sometimes you're going to remember information and realize that you answered the question incorrectly. But again, do not change it unless you have a valid reason, not because, oh, well, I think this one, etc. Understand you're not going to be able to backtrack on most of your examinations. It's also important to watch your timing. Evaluate timing on practice exams. Try not to spend more than 1 minute on each question. That doesn't sound like much time, but really it is a very sufficient amount of time. You will have 1.5 minutes per question on every exam. Monitor your time if needed. For example, you've got 75 minutes for a 50-question test, so at about 37 minutes, you should have completed about 25 questions. At about 19 minutes, you should be on approximately question 12 or 13, etc. So you can monitor your time. When you're answering questions, eliminate all options that you can and then pick the best choice. And understand these are computerized tests. There is no pattern of correct answers. The position of the correct responses are randomly selected, and we randomly arrange the questions for every student's test. The computer does that for us automatically. And also on your SATA questions, your select all that apply, you can have one response correct. They can all be correct. So always understand that. Don't try and second guess your instructors. Well, all of the SATA questions only have 3 or 4 answers correct. That's not the case. It's also important to understand a little bit about nursing exams from the viewpoint of the nursing school hospital. This is an ideal environment in your exams. Unless it tells you, you always have adequate staffing, equipment, supplies, etc., to provide the safest care for the client. Always assume that your clients are going to respond as textbooks indicate they will. We know that in real life they don't necessarily, but the textbooks provide the most common responses, and that's what you will be tested over. When you call the doctor or anyone else, you need to be very cautious about passing the responsibility for care of the client to someone else. Remember, these are nursing tests. You are the nurse, and you, as the nurse, need to take care of the issue the majority of the time. The examination is an exam on nursing care. Evaluate the question carefully and see what nursing action should be taken for consulting or calling someone else. If values such as a heart rate or lab result are close to normal, for example, we know that a normal heart rate is 60 to 100. If it is slightly out of range, so that heart rate is maybe 58 or 102 or 105, or if it's an expected finding, we're just going to monitor that client. We're not going to pick up the phone and call the doctor and say, oh, I have an elevated heart rate. It's 101. Your doctors are going to get very irritated very quickly. If a nurse cannot do anything to resolve the question, then calling for assistance may be the best answer. And if it's a task that's outside the nurse's scope of practice, or if the client is in a life-threatening, life-altering situation, call the doctor or the charge nurse. With doctor's orders or prescriptions, again, it's always assumed that a doctor's order is available to provide the nursing care in the options that have been presented. If the question asks for the administration of a specific medication for the client's problem, we assume there is an order for it. And it should also be assumed that if it is a response option, it is a viable option. And I've said that before. We also need to focus on the client. So look for answers that focus on the client, not on the hospital rules or policies or equipment. Always evaluate the status of the client first, provide for the client's safety, then we deal with equipment problems or concerns. As for the client's age, we consider a client to be an adult unless otherwise stated. The majority of your nursing courses are going to be talking about the adult. We consider the adult to be from age 18 to the age of 65. So all of that in between. If it is going to be below the age of 18, we consider that to be pediatric. And your question will state that it is a pediatric client or given age. If it is above the age of 65, we consider that to be an older adult. And your question will state that it is an older adult. With lab values, it's important to be familiar with normal values of common labs. NCLEX is often going to provide the normal values within a question, but you really need to know the indications of the value and whether it's normal or abnormal. Dosage calculations. You will be doing dosage calculations on pretty much all of your exams. A basic calculator will be provided as necessary. We do not allow any scientific calculators or phone calculators. You're often going to be directed as to how to provide your answer. Provide your response as a whole number or provide your response to the nearest tenth. During your calculations, you may have a lot of decimal places in your calculations. Excuse me. We highly recommend that you round to the nearest hundredth during your calculation, but your final answer should be provided as directed. Test anxiety. Oh my goodness. It produces tension and stress before, during, and after the examination. It blocks the student's ability to think and it can cause poor performance. Students can have difficulty concentrating and focusing when taking an examination. They may also experience physical symptoms such as shortness of breath, hyperventilation, stomach ache, nausea, vomiting, diarrhea. The list goes on. There are some measures to help prevent and reduce test anxiety. First of all, you need to manage your time well and develop those good study habits like I've talked about throughout this presentation. Do not procrastinate. Practice relaxation techniques. One of my favorite are deep breathing exercises. This is very important to induce relaxation. It's not just taking one deep breath or two deep breaths. You have to take multiple deep breaths. Take a walk around the parking lot, etc., before you sit down to take your test. One instructor I know used to have the students stand behind their chairs and do 10 jumping jacks prior to sitting down to take their test. Develop good test taking skills. Make sure that you clarify those weak areas with your instructor. If you find yourself overthinking questions or becoming too anxious when you're trying to answer a question, or you flip to the next question and your mind just goes blank, stop. Close your eyes. Take a couple of deep breaths. Clear your mind. Take another deep breath. Open your eyes and then refocus on the question. I like this little cartoon. I realize that now you're in nursing school, you need some privacy to study, but is building a brick wall really necessary? The majority of the areas where LPNs have charge nurse duties are going to be in long-term care facilities. It's really important for all nurses to understand the scope of practice of the rest of the healthcare team. UAPs, or the unlicensed assistive personnel, aka CNAs, provide basic client care. They cannot teach, they cannot assess, they cannot evaluate, they cannot treat. LPNs cannot provide critical care and should not care for clients under the age of 12. LPNs can direct the care provided by nursing assistants or other LPNs. LPNs will be under the supervision of a registered nurse. It's very important to pay attention to the nursing action the question is focusing on, and to whom the nurse is assigning the care or nursing activity to make sure it is within this person's scope of practice. As you learn to delegate, you'll make assignments to those caregivers who are emotionally prepared, experienced, and most capable of caring for the client. CNAs, or the UAPs, are going to require direct supervision from the LPN or RN. Assign tasks that have specific guidelines. Those tasks that have unchanging guidelines and are used in the care of stable clients. Again, keep in mind the nursing school hospital where you have adequate staff to provide the care, and the only client to consider in each question is the client involved in that question. So we identify the most stable client. The most stable client is going to be the one that has the most predictable outcome and is least likely to have abrupt changes in condition that would require critical nursing judgment. We look at Maslow's hierarchy of needs when considering the stability of a client. The most stable client is often the one whose care can be delegated to a nursing assistant. So carefully read the question and determine which clients are in an unstable situation. So things are changing, the client is unstable. There are clients that may require notifying the registered nurse or charge nurse or a physician. And can the nurse meet the client needs? Now we need to talk about establishing nursing priorities. First of all, we look at Maslow's hierarchy of needs, physiological versus psychosocial, and safety issues. But let's go back and look at some prioritization words. Best, essential, first, highest priority, immediate, most important, next, primary, and vital. Those are all prioritization words, and that means you need to determine out of all of these answers that look correct, these are things that I would do in this situation, which one do I need to do first? When you're looking at your client, you need to identify your priority client. The priority client is going to be the one that is most likely to experience problems or ill effects if they're not taken care of first. As I stated a few minutes ago, unstable or changing situations have priority, and those clients who are at an increased risk for developing complications. We also look at acute versus chronic. Acute issues are always a higher priority than chronic issues. So let's get back to Maslow's hierarchy of needs, that physiological versus psychosocial. Physiological needs, in other words, the needs of the body, always are met before the psychosocial needs, the needs of the mind and the spirit, etc. We start off by looking at ABCs: airway, breathing, and circulation, in that order, are going to be the most critical physiological needs. And don't read into a question either. Just because airway may be an answer option does not always mean that it's the correct choice. Read the question carefully. Determine what answer option is going to be of the most benefit to the client. So in identifying priority needs, we look for the need that is going to cause death or severe complications if we don't treat it first. So to repeat, ABCs, when answering questions, often have priority. Again, in that order: airway, breathing, circulation. If an intervention is going to prevent client decline or death, it's probably the right one. Safety and mental status will come after our ABCs. We need to reduce environmental hazards, such as preventing falls, accidents, prevention and spread of disease, and medication errors. And regarding infection control, hand washing or hand hygiene is often the correct response. It's also important for you to understand that pain is rarely a priority. We as nurses have a client who reports pain that is a 9 on a 1 to 10 scale. Oh my goodness, their pain is horrible, it's severe, I need to take care of that. Yeah, well, it does require attention, but it's often not the most important thing within the question. And always understand, too, that the least restrictive intervention should always be done first. Now let's talk about communication questions. These questions should encourage the client to answer in more than a yes or no response. Never be confrontational or offer false hope. It is okay to summarize or paraphrase a client's statement. Your response should indicate acceptance. Remember, you are the nurse and you should be taking care of the issue. If you have a response that says, "Oh, would you like me to call your pastor for you?" No, that's pushing the problem off on someone else. You're the nurse, you take care of it. And like I said, don't push it off on someone else. Don't offer to call someone else. Don't refer the issue to someone else. It is important for you to learn to look for those keywords. There's frequently going to be more than one correct answer, and you just need to choose the best answer. So, how do you do that? Well, some of the keywords that we need to look for: early or late. When asked what is an early or late sign and or symptom of something, you need to remember pathophysiology. Best. When you see questions that ask what the best intervention is, understand that there may be more than one correct response there, but which one is going to have the biggest effect? First, you're going to see questions that ask, what is the first thing you need to do, or what do you expect to see first? Initial. These questions are similar to those first questions, and you're going to see, what will the initial assessment show, or what is the initial action? Immediately. So what is the immediate problem, or what intervention should be done immediately? Most likely or least likely. These questions are more about what you might see or hear regarding what is happening with the client. What would you most likely expect the client to do? What would you least likely expect the provider to prescribe? Most appropriate or least appropriate? Again, these questions are going to be related to communications and interactions, as well as some interventions. When you're looking at your test, look for similar options. If any of the options have the same idea, they are more than likely incorrect and can be eliminated. Remember, there is going to be only one correct answer in most of your questions, and usually the answer is going to be the option that is different. So, a hint, focus on what the question is asking. For example, the client is at risk for excess fluid volume. You need to think about the pathophysiology that's associated with each condition that's identified in that option. So, in this case, the client that retains fluid is the client with renal failure or heart failure. They have excess fluid volume. The client with an ileostomy and taking diuretics is going to lose fluids. So we know that that response would not be correct. So focus on what each question is asking. On the static questions, make certain that you're not selecting opposite choices. In other words, you have a question, you cannot answer fluid volume excess and fluid volume deficit in the same question. Those contradict each other. Always look at the bolded, highlighted, and or italicized words. Those are clues. That means, hey, pay attention to me. On those static questions, select all that apply. Does the question provide you with the number of responses? Always be in the habit of looking. So approximately half of your questions are going to say, what are 4 responses that would answer this question? Or it may not give you any number, but you need to be in the habit of looking. Look for special words. Understood versus requires additional education. Did versus did not. Is versus is not, etc. And there's also some terminology to be familiar with when you're taking nursing tests. Patient is often referred to as client. Doctor is often referred to as provider or healthcare provider. Order is often referred to as prescription. CNA, that certified nurse assistant, is often referred to as UAP, unlicensed assistive personnel. The RACE model provides a critical thinking strategy when answering nursing multiple choice questions. So RACE, R, recognize what information is in the STEM. You're recognizing those keywords and you're recognizing who the client is in the STEM. A, ask, what is that question asking? Ask specifically what it's asking you to do. C, critically analyze. You need to analyze those options in relation to the question that's asked in the STEM. Scrutinize each option in relation to the information. Identify a rationale for each option. Compare and contrast the options. E, eliminate. Eliminate as many options as possible, one at a time. So let's look at some questions here. Which client statement made to the nurse indicates the client requires additional teaching regarding a low sodium diet? Okay, this client requires additional teaching, meaning that the client made a statement that is incorrect. They don't understand the teaching that was provided. So you're going to have 3 answers that are correct regarding a low sodium diet, and you're going to have 1 response that's incorrect regarding a low sodium diet. I'm going to use spices when cooking instead of salt. I like to eat several pieces of bacon for breakfast. I will learn to read package labels. I will rinse canned vegetables before cooking. Well, the only incorrect statement there is going to be the one that has a lot of sodium in it, and that is B. I like to eat several pieces of bacon for breakfast. Excuse me. A lot of your processed or preserved meats are very high in sodium, and this includes bacon. Make sure that you don't read extra meaning into the question. So the question says, we have a bronchoscopy performed on a client at 7 a.m. The client returns to his room and the nurse plans to assist him with his morning care, but the client refuses. What is the best nursing action regarding this client? So make sure that you read the question carefully before you look at or consider any of the options. If you begin to glance through those options before you really understand what the question is asking, those key words can influence how you perceive the question. So you aren't really paying attention. So I do highly recommend that you cover the answer responses until you feel like you understand the question. And don't read extra meaning into the question. Don't ask what if or the client might, etc. And if it appears to be common sense, it often is. So the correct response here is C. The client is experiencing shortness of air. What intervention must the nurse complete first? Oh, well, first of all, I have a highlighted word that has been italicized. Do I apply oxygen at 2 liters per nasal cannula? Do I administer a bronchodilator? Do I elevate the head of the bed? Do I obtain an oxygen saturation level? Again, we want to look at the least invasive, least restrictive intervention first. And elevating the head of the bed can be done very quickly. We know that this is going to help allow our client to expand the diaphragm better and potentially breathe better. So this should always be your first response. The others are important, but it's not what should be done first. We have a recent mastectomy client state, my husband can't look at me and we haven't had sex since my surgery. What is the nurse's best action? Do we arrange to speak with the husband about his concerns? Plan to teach the husband that the wife needs his support? Explore the client's feelings about her husband's behavior? Make an appointment with Reach for Recovery for the client. So first of all, we need to determine what this question is asking. Who is the question concerned with? We have several different options here. We have 2 that deal with the husband. We have 1 that deals with the client. We have 1 that deals with passing off um, the action to someone else, such as Reaching for Recovery, which is just FYI, a support group for women who have had mastectomies. Well, if we read the question again, the question is actually concerned about the client. The statement that reflects the client's concerns is C. So that's who the client is, who the question is referring to. That does eliminate options A and B. And again, in option D, the nurse is sidestepping the issue and avoiding personal responsibility. A dying client is withdrawn and depressed. What are the most therapeutic actions by the nurse? This is a static question, so select all that apply. We need to look at all of the options. We start off by looking at what is this question asking? The client is withdrawn and depressed. What are the most therapeutic actions? Well, I have a highlighted word there, most. So which ones are going to provide the best response? Is it explain the fact that the client's goals can still be accomplished? Will that provide therapeutic action for a withdrawn and depressed client? Probably not therapeutically. We know in the back of our mind that this will be a goal, but not necessarily going to be something that we want to tell someone who's depressed. Assist the client to focus on positive thoughts. Is that going to be therapeutic in someone who's withdrawn and depressed? Potentially, but we really want to get them out of that withdrawal. We want them to begin interacting again. We want to help them leave that depression behind. Positive thoughts can be important, but let's keep looking. Offer the client advice when appropriate. Are you, as a nurse with a nursing license, qualified to do this? Accept the client's behavioral response. Yeah, we need to accept the client where they're at. That would be very therapeutic. The client who does not have someone telling them, "Oh, you need to look at the bright side of things," etc., is going to be more likely to be responsive to you. Tell the client that you're available to talk. Oh, that one sounds good. Um, I'm not forcing the client to come out of their shell and talk to me about dying. I'm letting them know that I'm available if they do want to talk. So the correct answers are actually D and E. So if you notice when we went through each one of these responses, we are taking the response back to what the question is asking, looking at it kind of as a true or false. And again, don't anticipate how many correct responses there might be. Make sure that you read the stem correctly. Well, first of all, what is the stem? The stem of a question is basically what the question is asking. So try and rephrase the question. This question says, the nurse is discussing body mechanics with a client who has had back surgery. What nursing observations would indicate the client did not understand the principles discussed? So first of all, I know that I'm looking for something that the client did or said that was incorrect. So I'm going to have 3 appropriate ways of dealing with body mechanics in someone who's had back surgery. So let's rephrase the question. How about, what is the client doing wrong regarding body mechanics? The client bends at the knees to pick up an object from the floor. The client carries the object close to his body. The client places his feet apart when bending to pick up an object. The client bends from the waist to pick up an object on the floor. Well, hopefully we all know that D is an incorrect response. A, B, and C are all correct body mechanics. It's important to pay attention to where the client is in the disease process or condition. A client had a cardiac catheterization through the left femoral artery. During the first few hours after the cardiac catheterization procedure, which nursing action would be most important? Always look at that highlighted word, most, in this situation. Are we going to check his temperature every 2 hours and monitor the catheter insertion site for inflammation? Elevate the head of the bed 90 degrees and keep the affected extremity straight. Evaluate his blood pressure and respiratory status every 15 minutes for 4 to 6 hours. Check his pedal and femoral pulses every 15 minutes for the first hour and then every 30 minutes. So again, where is the client at in this process? So they had a catheter or cardiac catheterization during the first few hours after the cardiac catheterization. Okay, so what is going to be the most important nursing care in those first few hours? They have gone into a major arterial site. We know that the pressure in the arteries is going to be much stronger. So bleeding through an arterial puncture is going to be a higher risk. Well, how would I assess if there's bleeding? Well, I do need to look at the site, make sure there's no abnormal bruising, that the site has not abnormally enlarged due to bleeding under the skin. But another way would be to check my pulses. If I'm bleeding out of an artery, then I'm going to have poor pulses further away from that site. So if it's femoral, I'm going to be checking my pedal pulses or my foot, and I'm going to be checking my posterior tibialis, so behind the knee. I can be checking those pulses to help determine that my client is not bleeding. Correct answer is D. Also consider the characteristics of the condition and critical nursing concepts before the options. We have a woman who is 3 days postpartum who returns to the clinic with complaints of soreness and fullness in her breasts. What is the best nursing response? So again, looking at your highlighted words, I know that one answer is going to be better than the others. And because it is the best, some of those answers may sound pretty good. So let's look at this a little deeper. Should we show the client how to apply a breast binder to decrease the discomfort and the production of milk? Should we tell the client that breast fullness may be a sign of infection and she will not be able to continue breastfeeding? Should we suggest to the client that she decreases her fluid intake over the next 24 hours to temporarily suppress lactation? Or should we explain to the client that the breast discomfort is well, I can't see that word, but that the infant sucking will promote the flow of milk? So basically, this situation, we need to know, is this an abnormal or normal finding for the postpartum woman who is 3 days out of delivery? She's got soreness and fullness in the breast. This is actually a normal finding. This is not abnormal. Her milk has come in. Her breasts are now full. They're going to be sore until the baby has established the appropriate supply. So mama's going to be sore and achy for a few days while this occurs. So D is the correct answer. Identify the step in the nursing process being tested. We have an 85-year-old client who's a resident in a long-term care facility. The nurse assigned to the client observes numerous bruises and abrasions in various stages of healing on the client's back and torso. The nurse from the previous shift explains that the client fell down. What is the best nursing action? So once again, note your highlighted word, best, meaning that we have some that may look pretty good, but we have to determine which one is the best. Is it review the chart for details regarding the client's fall, cover the abrasions with a protective dressing, notify the supervisor regarding the possibility of, excuse me, of an abuse situation, or further evaluate the client to determine the presence of other injuries. In this question, the stem of the question really does not present enough information to make a nursing judgment. So we need to focus on the client's physiological needs. That will be the priority. Nothing in this question tells us that the client has suffered from abuse, other than that they have bruises. Well, bruises can come from a number of things in the older client. Just the fact that uh, older adults can suffer from what we call senile purpura, which is where they just barely bump their arm or their leg or a part of their body up against something, and they have this massive purple spot that doesn't go away for a long period of time. Maybe they're on anticoagulants, so the person has been bumped, or maybe someone had their hand behind their back to help hold them up when they began to fall, etc. It could create that. There's nothing there, basically, is what I'm saying, that indicates that they're in an abusive situation. There's also nothing that indicates that we need a protective dressing on. They do have some abrasions that are in various stages of healing. So this says cover the abrasions. It does not say cover the open abrasions. And it also says to review the chart for details regarding the fall. Well, I mean, that may provide you with some information, but is it really going to address the situation that's going on? So, first of all, I need to evaluate this client further to make sure that there are no additional injuries before I start determining or making any type of judgment. Correct answer is D. Are you confused yet? Well, let's look at another question. At 10 a.m., the nurse is evaluating a client who's scheduled for a thoracotomy at noon. Which client finding would be most important for the nurse to report to the nursing supervisor? As we're looking at this type of question, I'm looking for something that is wrong. I need to tell someone who has more authority than I do about what is going on with this client. So I need something that's wrong. This type of question is where we apply that if I have something that is just a little wrong, isn't necessarily going to be the right choice. I need something that is blaringly wrong. So, is the question asking for problems regarding the surgical preparation or the current status of the client's condition or preoperative teaching? Let's look at the responses. Vital signs are pulse 100, respirations 20, oral temp 99. Surgical consent is not signed and on the chart. The client states that he is anxious about the surgery. Lab reports indicate the hemoglobin is 12.5 and the hematocrit level is 36%. 12.5 is a little bit low for a male client. It's okay for a female client. Client being anxious about the surgery. Well, yeah, we pretty well expect that. Most people are anxious prior to a procedure. We should probably investigate the extent of the anxiety, but that's not something I'm going to pick up the phone and call someone about. Our vital signs, pulse is the higher end of normal, but it's still within normal ranges. Our temp is 99. It's a little above what we consider to be normal, but it's okay. But the fact that the surgical consent is not signed and on the chart when the client is going to be going to surgery in 2 hours, and that's pretty significant. Why is that not signed? What is going on? Does the client require additional teaching? Does the client not understand something? Is the client changing their mind about having the procedure done? This one needs to be reported. Don't focus on predicting a right answer. So in this question, a client has an ulcer 2 centimeters by 2 centimeters by 0.3 centimeters on the calf of his right leg. The area around the ulcer is inflamed and the ulcer is draining purulent fluid. Vital signs are pulse 114, respirations 22, temperature 101 degrees. Which order should be implemented first? Penicillin B, potassium, 500 milligrams PO every 6 hours. Blood cultures times 2, 20 minutes apart and drawn from different venipuncture sites. Polysporin ointment topically to the leg ulcer, TID. Acetaminophen, 650 milligrams suppository every 4 hours for a temperature above 101.8. This is kind of difficult. We need to look at this. Try rewording the question. We know the client has an infection in the ulcer on his leg. His temp and pulse are elevated, which are normal responses to infection. Is that temp significantly high? Well, it's high, but it's not horribly high. Of all these orders that are listed here, which nursing action needs to be done first? So let's rank these options. Yes, antibiotic needs to be started to fight the infection, but it's going to take time to see any results. Blood cultures are going to help determine the causative bacteria, but again, it's going to take time to see those results. The polysporin ointment, this is a topical antibiotic that's going to treat surface bacteria, but is it going to treat a deeper infection? It's going to take time to see results. And the acetaminophen, it might make the client more comfortable, but it does not treat the problem. Okay, so none of these look really great, but as we start looking at this, how do we know that penicillin is going to be the right antibiotic? If the client is beginning to develop a higher temperature, then that means that this may be more than just a surface infection. So polysporin may not be the appropriate thing. The only way to figure out that we are getting the right antibiotic is to do those blood cultures. Putting off the administration of an antibiotic for the 20 minutes that it's going to take to draw blood cultures is not going to create harm in this client, and it will help us get the right antibiotic for this client. So the correct answer is actually B. Evaluate all of the options systematically. A client has just returned from the recovery room after a lumbar laminectomy with a spinal fusion. In considering possible complications in the next few hours, what nursing action is most important? Realize these options that have been given may not be what you think should be done, but we need to choose the most appropriate choice offered after we evaluate. So let's look at these options. Monitor vital signs routinely, assess breath sounds every 2 hours, evaluate every 2 hours for urinary retention, check when he last had a bowel movement. Well, we do know that we're going to be monitoring vital signs routinely. That's pretty much done every time we do any type of procedure. Assessing breath sounds every 2 hours. Well, breath sounds are going to be very important. We may not be assessing them quite that often in the first few hours after surgery. Every 4 hours is usually going to be pretty appropriate. Evaluate every 2 hours for urinary retention. Why would this one be important? Well, they had surgery, they had anesthesia. Anesthesia can actually cause paralysis or decrease the peristaltic action of not only the gastrointestinal system but also the genitourinary system. So a lot of people have urinary retention following anesthesia administration. So making sure that the client is peeing or is releasing urine is going to be very important. Checking when he had a last bowel movement. Well, a few hours after surgery, it's probably not going to be a big deal. We know that anesthesia, like I just said, can decrease the peristaltic activity of the GI system. So they may not have a bowel movement for up to 48 hours after receiving anesthesia. So knowing when their last bowel movement was is not necessarily going to be important when we're talking about the first few hours after surgery. The correct answer here is C. Eliminate obviously incorrect options. The nurse is performing a urinary catheterization on a female client. When cleansing the labia, what action should the nurse complete? Do we cleanse the inner labia and then cleanse the outer labia? Do we cleanse the perineum from back to front with a cotton ball? Do we use each cotton ball only one time? Do we inspect the vaginal opening for any abnormalities? So obviously incorrect ones. Once you learn how to insert a Foley catheter, you know that we clean the outer labia first. You know that with females, and this is a female, that we always cleanse from front to back, never back to front. we're not cannulating or not putting a catheter in the vaginal opening. So we eliminate those obviously incorrect options. That leaves us with C. We only use each cotton ball one time. Identify similarities in the options. The nurse is assisting a client to identify foods that would meet the requirements for a high protein, low fiber diet. Which foods would represent the correct choices for this diet? Again, high protein, low fiber. We have roast beef, slice of white bread, fried chicken, green peas, broiled fish, green beans, cottage cheese, tomatoes. Okay, so unless specified, don't attribute special characteristics to a food. Special characteristics are going to be stated, and I mean like low fat or low sodium, etc. So as we look at these options, A, B, and C all contain a meat or a fish, so they all contain high protein. B, C, and D all contain a skinned vegetable, excuse me, or high fiber. So if you look at these, fried chicken is definitely going to have some protein in it. Peas are going to be a higher fiber. Broiled fish, protein, green beans, high fiber, high protein. Cottage cheese, tomatoes. Tomatoes are going to be more of your fiber. Cottage cheese will have some protein, but it's not going to have the high protein. Our roast beef, high protein. White bread. White bread has low fiber. When you want the high fiber with your breads, we need to be going with our grains. So we want our 100% wheat bread, our 12 grain breads, etc. The rye bread, those breads that have not had a lot of that nutritional content removed, as in white bread. White bread honestly is not that healthy. Identify the qualifiers in the options. The nurse is obtaining a specimen from a client's incisional area for a wound culture and sensitivity. What client information will the sensitivity part of the procedure reflect? Okay, response number 1. Presence and characteristics of all bacteria present in the client's wound. B. Which antibiotics will effectively treat the bacteria present? C. Differentiation of the bacteria and viruses of what is in the wound. D. All treatments to which the bacteria is responsive. Okay, again, we're looking at some qualifiers. And I'm going to tell you that if you have some of those that are those limiting words, such as all, every, none, those are usually going to be incorrect. I'm pretty confident in saying that you should never, and that's another qualifying word, choose a response that has one of those qualifiers. So if we look at these responses, both A and D contain the word all. Presence and characteristics of all bacteria. That is going to be incorrect. All the treatments to which the bacteria is responsive. Again, these options are unfeasible from a culture and sensitivity um, viewpoint, and they can be eliminated. So again, avoid those answers with the words always, never, must, all, or none, every, etc. The correct answer here is actually B. Which antibiotics will effectively treat the bacteria present? Select the most comprehensive answer. The nurse is planning to teach a client with diabetes about his condition. Before the nurse provides instruction, what is most important to evaluate? All of these options might be correct, but one option may need to be considered first. Our options are required dietary modifications. Well, yeah, we need to do that. Understanding of the exchanged list. Yeah, that's important. Ability to administer insulin. Well, is this client going to be getting insulin? It's not necessarily something every diabetic will be receiving. Present understanding of diabetes. This is really important. I need to know what the client knows at this point in time, so now I can either correct any misunderstandings or build on what they already know. Correct answer, D. Options with multiple considerations. All parts of the responses have to be correct, not just some of the options. So let's look at this. The nurse is preparing a client's medications. We have digoxin 0.125 milligrams PO, furosemide 20 milligrams PO, captopril 25 milligrams PO. Vital signs: blood pressure is 110/86, heart rate 78, respirations 18, temp is 99 oral. What would be the best nursing action? Administer all medications, chart them as given, and document the apical heart rate. Hold the digoxin and the captopril, recheck the heart rate and the blood pressure in 30 minutes. Hold the captopril, administer the other medications, and notify the nursing supervisor. Hold the furosemide until the intake and output is evaluated. Administer all other medications. Okay, so let's look at these medications. Digoxin is a heart medication. One of its main effects is it's going to slow down the heart rate. And we have orders that if the heart rate is below 60, we're not going to administer this medication. Furosemide is a diuretic. It makes us pee. Captopril is going to be administered for blood pressure. Well, our blood pressure is 110/86. Heart rate is 78. Okay, so again, all parts have to be correct. Are we going to hold the furosemide until the I's and O's are evaluated and go ahead and administer everything else? Well, why would we hold the furosemide? Nothing in the question indicates that the furosemide needs to be held. Hold the captopril, administer the other medications, and notify the supervisor. Why would we hold the captopril? We have a blood pressure of 110/86, meaning this client's blood pressure is probably well controlled on his medications or her medications. Hold the digoxin and the captopril, recheck the heart rate and blood pressure in 30 minutes. Blood pressure is 110/86, heart rate is 78. These are good readings. There's no reason to hold these medications. So we're going to administer all of these medications, chart them as given, and document the apical heart rate. The correct answer, A. Last question. Make sure that you reread the question after selecting an answer. A client is 88 years old and has previously been alert, oriented, and active. The UAP reports that on awakening, the client was disoriented and confused. What initial action would the nurse take to determine the possible cause of this change? Let's look at this question. We have an older adult, previously alert, oriented, and active. Now the client has woken up, they're disoriented and confused. What is my initial action? I have a significant change there. Our response choices: review the history for any previous episodes of this type of behavior, call the healthcare provider and discuss the changes in the client's behavior, do a thorough neurological evaluation to evaluate specific behavior changes, evaluate for the presence of a urinary tract infection and for adequate hydration. Okay, I know you haven't learned this yet. However, you will be learning that older adults do not always respond the same way that younger adults do. When older adults have an infection, one of the first things that we see is a change in their mental level. They were alert and oriented, and now all of a sudden they're confused. That is one of the first things we want to do, is check for an infection. Most common site of infection in the older adult is going to be a urinary tract infection. So the correct answer is D. We're going to check for that urinary tract infection. And we also want to address their hydration status, because this could also potentially cause confusion. But make sure that you reread that question. My client was alert and oriented. He's 88 years old, and now they're disoriented and confused. My initial action is I need to check out if there is an infection.